A 30-year-old man presents himself with chronic cough, dyspnea, anorexia, and weight loss. He developed these symptoms gradually over the last few years. His busy primary care physician, after a brief history taking, examined him and came to a probable diagnosis of pulmonary tuberculosis. He prescribed a number of tests, including a chest X-ray. Only if he had asked this patient, who was a farmer, one simple question: what exactly is the nature of your work? The doctor would have arrived at an accurate diagnosis of a clinical syndrome called farmer's lung, a type of hypersensitivity pneumonitis. Effective history taking has long been identified as a core discipline in treating patients. Spending more time compiling a good patient history has been known to provide the most benefit as compared to long physical examinations and expensive laboratory tests. Collecting an incomplete history can affect initial therapy and all subsequent decisions for treatment. Therefore, it is essential that primary care physicians ensure that neither the patient nor the health system is unduly burdened by deficient history taking. Primary care providers and family physicians can play an important role in improving the recognition of occupational disease, preventing progressive illness and disability in their own patients, and contributing to the protection of other workers similarly exposed. This role can be maximized if physicians raise their level of suspicion for workplace disease, develop skills in taking occupational histories, and also learn basics of advising prevention. World Health Organization calls farming or agriculture as one of the most hazardous occupations. The term agriculture is generally used in a broad sense to include all activities directly related to cultivating, growing, harvesting, and primary processing of agricultural products, animal and livestock breeding, and also aquaculture and agroforestry. Since independence, India has made immense progress towards food security. Indian population has tripled and food grain production has more than quadrupled. There has been a substantial increase in available food grain per capita. Half of the total world labor force is engaged in agricultural production. 60% of them are in developing countries and more than 20% in India. Today, India ranks second worldwide in farm output. Agriculture and allied sectors like forestry and fisheries accounted for about 15% of the GDP. India is the world's largest producer of many fresh fruits and vegetables, milk, major spices, select fibrous crops such as jute, millets, and castor oil seed. India is the second largest producer of wheat and rice and the seventh largest agricultural exporter worldwide. Whatever be the agricultural activity, the characteristics of the work are: exposure to a variety of machines, delay in medical attention, emergency services in time of accidents due to the remoteness of a high percentage of the work sites, increasing the risk of farm-related accidents to children due to proximity of dwellings to workplace, exposure to climatic conditions while working out in open air, seasonal nature of work, urgent in specific periods, and exposure to dusts. High proportion of very young and old workers. Exposure to bites, infections, allergies, and other health problems due to contact with animals, plants, media like soil and water. Contact with toxic chemicals and biological products such as pesticides, rodenticides, fertilizers. Multiple tasks performed by single person causing variation in working postures and duration of tasks. The perception of agricultural work is that of a healthy occupation that provides an opportunity for plenty of fresh air and exercise. However, agricultural work is prone to a large variety of health problems, and the workers are at high risk for respiratory diseases, skin conditions, particular cancers, and many types of injuries. We will start with respiratory health conditions. Occupational asthma of farmers is immunoglobulin E-mediated asthma caused by either sensitizing agents or irritants. Sensitizing agents can be cereal, grain, pollen, livestock dander, fungal antigens in grain dust and on crops, dust mites and organophosphorus insecticides, one or more of them. Please remember that clinical presentation of occupational asthma does not differ from other types of asthma, and hence work history is very important. Occupational asthma is characterized by A. Acute reversible obstruction of the airways caused by bronchoconstriction, airway edema or inflammation, and B. Mucus excretion induced by exposure to agents inherent in the work processes. Clinical presentation shows transitory chest tightness, shortness of breath, wheezing and lung functional impairment, and also headache, fever, nausea, vomiting and coughing. Chest X-rays show small opacities distributed throughout the middle and lower areas of the lungs. Chronic disease may develop after repeated acute episodes. Chest X-rays show the development of diffuse interstitial pulmonary fibrosis. We will enumerate most common types of dust and what hypersensitivity reaction occurs to cause health problem or syndrome in farmers. This reaction is also called extrinsic allergic alveolitis. Presentation is similar to influenza. Hypersensitivity pneumonitis results from exposure to fungal spores or thermophilic actinomycetes released from moldy grain or hay. Moldy hay causes farmer's lung. Moldy bagasse causes bagasosis, peculiar to only sugarcane farming and is caused by thermophilic actinomycetes from moldy sugarcane. Mushroom compost causes mushroom picker's lung by exposure to mushroom spores during clean-out of beds. Cork dust causes tuberosis. Maple bark can cause maple bark disease, pneumonitis. Wood pulp causes wood dust pneumonitis. Redwood sawdust causes sequiosis. Moldy barley causes malt worker's lung, aspergillosis. Moldy straw also causes aspergillosis. Coffee beans cause pneumonitis. Paprika causes paprika splitter's lung. Cheese particles cause cheese washer's lung. Pigeon, parrot and other bird droppings may cause bird breeder's lung. This has a worse prognosis than farmer's lung. Animal hair causes pneumonitis. On the other hand, grain dust asthma is a non-immunologic asthma and is caused by exposure to grain dust. Grain dust is the dust produced from the harvesting, drying, handling, storage or processing of barley, wheat, oats, maize or rye and includes any contaminants or additives within the dust like bacteria, endotoxins, fungal spores, insects and insect debris and pesticide residues. Organic dust toxic syndrome could be due to exposure to plant debris, starch granules, molds, endotoxins, mycotoxins, spores, fungi, gram-negative bacteria, enzymes, allergens, insect parts, soil particles and chemical residues. Grain fever results from dust from stored grain. Wheat weevil is an anthropoid, a common pest in stored grain and kitchen and infests all kinds of whole grain. Wheat weevil disease is caused by infested wheat. The silo-unloader syndrome occurs due to moldy silage on top of silage in a silo, and silo-filler's disease is caused by nitrogen dioxide from fermenting silage. There are some other respiratory health conditions likely to occur in farming work. Acute pulmonary responses are caused by decomposition gases: ammonia, hydrogen sulfide, carbon monoxide, methane, phosgene, chlorine, sulfur dioxide, ozone, paraquat, anhydrous ammonia, oxides of nitrogen. Mucous membrane inflammation of respiratory system is caused by specific plant parts, endotoxins, mycotoxins. Bronchospasm, acute and chronic bronchitis, is caused by exposure to insecticides, arsenic, irritant dust, ammonia, fumes, grain dust. Metal fume fever is due to exposure to welding fumes. Tuberculosis particularly occurs in migrant workers. Oxygen deficiency in confined spaces causes asphyxiation. Valley fever, coccidioidomycosis, is caused by soil dust of arid regions. Valley fever is a mammalian fungal disease. Coccidioides is a dimorphic saprophytic fungus that grows as a mycelium in the soil and during rain develops as a mold that breaks off into airborne spores when it rains. Spores are swept into the air by disruption of the soil during construction and farming. Infections usually occur due to inhalation of the spores after soil disruption. The disease is not contagious. There may be no symptoms. Symptoms, if present, resemble bronchitis or pneumonia that resolves over a few weeks. There is a profound feeling of tiredness, fever, cough, headaches, rash, muscle pain, and joint pain. The classic triad of valley fever is known as desert rheumatism and includes the combination of fever, joint pains, and erythema nodosum. Some people develop a chronic lung infection or widespread disseminated infection affecting meninges, soft tissues, joints, and bone. We now come to skin or dermatological conditions. Most prevalent condition is contact dermatitis. It is caused by direct contact with ammonia and dry fertilizers, vegetable crops, bulb plants, fumigants, oat and barley dust, several pesticides, soaps, petroleum products, solvents, hypochlorite, phenolic compounds, amniotic fluid, animal feeds, furazolidine, hydroquinone, halquinol. Grain itch is caused by mites. Allergic contact dermatitis occurs from sensitizing exposure in farms due to exposure to certain plants such as poison ivy and poison oak and pesticides such as dithiocarbamates, pyrethrins, thioates, thiorams, parathion, and malathion. Tulip finger is a combined allergic and irritant contact dermatitis caused by contact with substances located in the outer layers of the tulip bulbs known as tulipocytes. Exposure to sun rays may cause just dermatitis or more serious conditions like melanoma and lip cancer. The causative agents are sunlight and ultraviolet radiation. Factors which make skin sensitive to UV rays are many. Inherited tendency to photosensitivity. Certain medications. Exposure to plants including weeds and edible plants such as carrot, parsnip, dill, fennel, celery, and anise. People with fair and light skin, albinos. People with lupus, porphyria, or polymorphous light eruptions. In general, exposure to UV rays for more than 30 minutes increases the risk. Remember that 50% of the UV radiation is emitted between 9 AM and 4 PM. Like sunlight, heat also can cause dermatitis. High temperatures in the form of hot weather, especially when combined with high humidity, can cause eczema. Eczema is more common during the summer months than during the winter. Moist and hot environments are causative agents. Arthropod-induced dermatitis, envenomation, Lyme disease, malaria, parasitic diseases like hookworm infestation. All these health conditions occur due to exposure to bites and stings from wasps, bees, grain mites, hornets, fire ants, spiders, scorpions, centipedes, other arthropods, and even snakes. Nicotine poisoning, also called green tobacco sickness, is an acute syndrome characterized by nausea, vomiting, headache, dizziness, and severe weakness, and accompanied by fluctuations in heart rate and blood pressure. Symptoms may be severe enough to require emergency medical treatment. One and only causative source is working with wet tobacco leaves. Burns can be caused by fire, electricity, acid or caustic chemicals, dry hygroscopic fertilizer, friction or liquefied anhydrous ammonia. Farmers may suffer from several toxic and neoplastic conditions: Hodgkin's lymphoma, non-Hodgkin lymphoma, Alzheimer's disease, acute and chronic encephalopathy, multiple myeloma, leukemia, cancers of the brain like glioma, prostate, stomach, pancreas, and testicle. Exposure to solvents, benzene, fumes, fumigants, and insecticides is the main cause. Some culprits are organophosphates and carbamates, herbicides, and fungicides. Sterility in male workers can be caused by exposure to ethylene dibromide. It is a colorless liquid used as a common pesticide and as a fumigant to kill termites and cockroaches, though not commonly these days. Injuries, punctures, and thorn pricks, if not treated, can result in tetanus. Injuries, mechanical and thermal stress conditions. Farmers are vulnerable to falls, being struck by objects, and injuries during handling of machines. They are at risk of crush injuries, getting trapped in fires, or getting electrocuted. Behavioral conditions. Suicide and the vulnerability to suicide is the biggest behavioral hazard for the Indian farmer. Nearly 3 lakh farmers have committed suicide in India from 1995 to 2013. Primary care providers can assess the risk of suicide by making an assessment of the patient's mental state and take appropriate interventional steps to address the symptomatic picture. The other major behavioral hazards that workers may face are feelings of isolation, anxiety due to economic threats, violence, substance abuse, incest, stress due to risk-taking, intergenerational problems and patriarchal attitudes, stress due to unstable weather, immobility leading to poor coping skills, depression, anxiety and suicidal thoughts. Prevention of occupational diseases and injuries. Preventive interventions require strategic contribution and efforts from government through occupational health and safety policy and legislation, cooperation from employers as well as workers, and advice from medical professionals. Occupational diseases manifest after long latency period from the time of exposure. There are challenges to establish and declare that a disease is due to hazard at workplace. Elaborate guidelines for management and prevention of occupationally caused diseases is beyond the scope of this documentary, as currently there is no mechanism for doctors to enforce their recommendation without a statutory backing. We therefore give general principles of prevention. Preventive measures should be designed and implemented at 3 levels of prevention. 1. Primary prevention aims to reduce the occurrence of disease by eliminating the cause of disease For example, use of benzene-free solvents or solvent-free paints to eliminate the risk of carcinogenicity, or reducing exposure to safe levels that prevent it from causing damage. For example, reducing noise at its source to levels that do not cause noise-induced deafness. 2. Secondary prevention to identify and treat health problems as early as possible, often before symptoms have developed, in order to take corrective action. For example, regular audiograms among workers exposed to high levels of noise in the work environment. 3. Tertiary prevention aims to avoid complications of and disability from illnesses and injuries and/or to provide rehabilitative and palliative care. It aims to minimize the consequences in persons who already have disease and depends on appropriate treatment. We expect that the primary care physicians are already well versed with clinical knowledge for management of the occupationally caused health conditions. To learn more about detailed clinical perspective, treatment and prevention and control, please refer to ebook or printed version of BOHS for Informal Industry, Manual for Primary Care Providers. So, if your next patient with any of the presenting symptoms we described earlier comes for treatment, please don't forget to ask him the $1,000,000 question. What exactly is the nature of your work?